The Cannabis Conversation. A European perspective on the emerging legal cannabis industry.
Welcome to the Cannabis Conversation with Anuj Desai, where we explore the new legal cannabis industry by speaking to the professionals that are helping to shape it. On today's show, I have Dr. Sandra Carrillo. Sandra is a professor in charge of cannabis research and education at the University of Panama. She's deeply involved in the international medical cannabis scene on a number of levels, which she'll tell us a bit more about in a minute. I'm really excited about this show. I've been a keen follower of Sandra's on LinkedIn, so it's a real pleasure to have her here. Sandra, welcome. How are you doing today?
Very good. Thank you, Anuj. I'm very happy to be here today with you and very happy to have this conversation.
Fantastic. I look forward to it too. So, look, I mean, you're very out there and you're involved in lots of little different projects and doing some amazing work in sort of pushing on the understanding of medical cannabis across the world. But before we talk about some of those projects, maybe we can talk a bit about you. And if you can sort of introduce yourself, tell us a bit about your background and what you were doing before cannabis and how and why you got into it.
Of course, I am a physician, medical doctor. I have a master's in healthcare services administration. Also, I have a certification in anti-aging and regenerative medicine. And I started studying about medical cannabis around 6 years ago. This has been a beautiful journey for me because I developed interest in medical cannabis. I am a volunteer of Epilepsy Children's Foundation. So like 7-8 years ago, I started seeing the mothers of the foundation flying to other countries to get medicine for their children, epilepsy. So I started seeing that these children were improving with this medicine. So I, as a doctor, I was happy to see the improvement on the children, but for me, that wasn't enough. I needed to learn and see where was the evidence, what was all this about. So I started studying and I got certified in Canada, in the United States, and in Latin America, precisely in Colombia. I flew to Israel, and I've been lucky enough to be able to see all the medical trends in Europe, in Latin America, in the United States. So it's very, very interesting for me to see the evolution of medical cannabis on the last 10 years. I am, as you mentioned, professor of the Faculty of Medicine, University of Panama, and I am in charge of the program of medical cannabis education and research. I live between Panama and Colombia. In Colombia, I am the president of the Colombian Medical Cannabis Association. We are a group, non-for-profit scientific association. We are doctors from different specialties. We promote the scientific-based evidence treatments. I'm also co-founder of Medican IPS, Medical Cannabis Clinics in Colombia, and I am working right now in a clinical research protocol for refractory epilepsy with a group of neurologists in Panama. So as you mentioned, I am dedicated to multiple projects, and all of them are very, very important for me.
Yeah, no, sounds like you're very busy. What do you think your main one is? Is it working at the university? Is that the main kind of role?
Yeah, for me, teaching and education is the most important thing right now. I have been honorary professor for the University of Mexico and for the Medical Association of Cannabis in Mexico, also for a university in Peru and for the Medical Association of Peruvian doctors. And I'm also professor of a diploma certification in alliance with one of the top universities in Colombia. So we've been teaching doctors and healthcare practitioners for around 3+ or 4 years. We've been teaching doctors from all Latin America. I'm also professor from educational platform in Brazil. So education is very important for me because right now I think the role of education is extremely important, because if we don't educate doctors and healthcare practitioners about the applications of cannabinoids and about the endocannabinoid system and about the research, medical cannabis will not be moving forward, because the first thing we need is the doctors to adopt the cannabinoid therapies into their toolbox. I always say the doctors all doctors should know about what is the endocannabinoid system, what is the scientific evidence that we have. And every time I go to teach doctors, I tell them that even if they don't leave the room after the class going to prescribe medical cannabis, as doctors, we have the obligation with our patients to learn about something so important like the endocannabinoid system. So it's very important that education is spread around all the scientific communities, because through education is that we can achieve the destigmatization of the use of medical cannabis.
Yes, absolutely. And education is very core to this show. So I love the fact that you're focusing on that. And actually, with that in mind, would you mind taking us through the process of when you decided to focus on cannabis? You know, because traditional medicine is not looked favorably on cannabis. So that must have been a big choice for you. How did you kind of come to that decision? And did you have any reservations, or were any of your family or friends or colleagues, were they a bit worried about you or, did they give you some advice?
Yes, that's, as I said, it's been a beautiful journey. Since I discovered medical cannabis, I was very skeptic about this. And first, when I saw with the children with refractory epilepsy, and I saw that they were improving, as a doctor, I said, something, maybe some placebo, maybe, so I had to search and go deeper into the science and into the research. And for me, the first time it hit me how important this was when I went to Canada to the CCIC, one of these lectures that they were giving there. And I saw this room full of like 300 doctors talking about medical cannabis. And when I saw that, I thought there is something in here, and I started studying and listening and learning and looking for evidence, because as doctors, we have the obligation with the patient to give them treatments based on scientific evidence. I never dismissed the patient's perspective or the patient's experiences, but for us, we need to preserve the patient's safety, and it's through the clinical research that we can see through RCTs, safety, tolerability, and the way the cannabinoids work in the human body. So it's been a beautiful journey, and I've been saying for years that medical cannabis redefining the future of medicine, because as I told you, I was a very traditional doctor. And for me, the word cannabis, and more coming from Colombia, that we've been on the war of drugs for years, was like a really a stigma and like a big word. So when I saw all the evidence behind cannabinoids and the way endocannabinoid system works, I really saw a big opportunity for patients to improve and to give them quality of life, because at the end, for me as a doctor, the thing that really matters is the patient. And sadly, I was prescribing different type of medications that sometimes they help the patient, but at the time that they were helping the patient, they were producing another disease or another conditions that they were not good for the patient. So for me to see how medical cannabis is such a noble treatment, that it has no lethalities reported right now, is something very important, because I always tell doctors we have to think that even Tylenol if you get the dose that is not appropriate, you can have liver failure. So we've been taking medications for so many years that they've been causing another pathology. We have to realize as doctors how important is to have cannabinoids in our toolkit. So it's very important, the part of the approach that since I realized medical cannabis is a very useful alternative for patients, my approach towards patients is totally different. First, I used to see the patient in a very automatic way because medicine, sadly, instead of being more personalized, with the more time running, doctors are always more rushing and they see the patient like super fast. They have just 20 minutes to see a patient. And I see that medical cannabis allowed me to go back to what the doctor needs to be. The doctor needs to be constantly in touch with the patient. The patient needs to feel that confidence in calling the doctor when they feel something. And medical cannabis allowed me, and I've been talking to a lot of colleagues, that when you do medical cannabis consultation or when you want to treat a patient with cannabinoids, you need to take a very good amount of time to evaluate everything is happening with that patient. So it's beautiful and the patients love it because I have like 1 hour or more than 1 hour assessing the patient situation. So it's beautiful because, as I said, I think medical cannabis is redefining the future of medicine and the approach the doctors will give to the patient.
Yeah, absolutely. I mean, it's sad that doctors don't get enough time with patients for consultations. And it's a really interesting point, which we could probably talk about a bit longer. But so back to the main topic is around the evidence for medical cannabis, because you're both a practitioner, but you're also researching as well. I mean, it's really difficult. It's such a big topic. Where do we start, I guess? Maybe you could talk about some of the main conditions that there is good evidence for in relation to cannabis.
Yes, that's a very important topic. And I always, when I talk to medical doctors or scientific communities, the one they are, I wouldn't say against, but they are the ones that they don't know about this. They're always saying, oh, there is not enough scientific evidence. And I said, we have very good scientific evidence, but we need to be very clear. And I said this to all doctors. Medical cannabis is not the panacea, is not a cure for everything, and is not a first-line treatment. When doctors are clear about this, we can assess the treatments and apply treatments to the patients with very good probabilities of being helpful for the patient. We need to manage expectations from the patients. That is the first thing that I say when I'm teaching doctors in how to prescribe medical cannabis is, first of all, assess what are the expectatives of the patient, because sometimes patients come thinking that it's going to cure cancer or it's going to be a cure for something. So if the doctor put in perspective those expectations and tell the patient what to expect, we will be more successful in our treatment. So talking about scientific evidence, as I mentioned, this is a lecture of a class that I give constantly to doctors and the scientific community, because we need scientific evidence in order to be able to provide treatments to patients, feeling confident that we're doing good and not with harming the patient. So the main pathologies that right now we have good scientific evidence around. And when I talk about good scientific evidence, I'll talk with randomized placebo-controlled trials or systematic reviews. That is like the gold standard of the clinical research. So based on that, we have, regarding to the latest, biggest review of all the studies in medical cannabis, there was a review on 2017 by the American Association of medicine and engineering, that they were talking about reviewing more than 20,000 studies. And among those 20,000, they found around 7,000 studies that they had different levels of quality. And after they did this exhaustive review, they found that there were different pathologies with very good quality of evidence. And that these pathologies were first refractory epilepsy. And we have in refractory epilepsy a specific syndromes like Dravet syndrome, Lennox-Gastaut syndrome, and recently last year was approved for tuberous sclerosis. So refractory epilepsy, we have very good evidence. We have RCTs.
Sandra, very quickly, what does refractory mean?
Oh, yes. Refractory is resistant to treatment. Refractory refers to those patients that they are already using 2 or 3, even 4 medications, and none of these work. So these are actually when the 30% of the patients with epilepsy end up being refractory to the treatment. So that's very important because sometimes to my consultation, patients come and say, oh, my kid just have a seizure yesterday. And then I come and I ask, is being diagnosed with epilepsy? Have you tried other treatments? And the patient thinks that just with the first episode, now you're a candidate for, or will benefit with medical cannabis. So we always need to be very clear that even we have an FDA approved medication, there is Epidiolex, that is cannabidiol isolate. And it was FDA approved, and the company who did all the research was GW Pharmaceuticals, and they did a good job with producing all these randomized placebo-controlled trials. So we have good evidence with refractory epilepsy. And actually, I'm very pleased to see that we have also evidence not just with the isolate, that is cannabidiol. There is good studies with whole plant products. So this is good. And we have also with refractory epilepsy right now studies talking about long-term efficacy. And I saw this study published recently talking that even patients after 1 or 2 years of being treated with cannabinoids, they still have a good response to the therapies, and even they get better responses after 1 or 2 years. So this is I'm very pleased about this, to see how refractory epilepsy finally has this alternative treatment that is cannabinoids, and that we have an FDA approved treatment for these children that nothing worked for them. So talking about another pathology that has good scientific evidence behind is multiple sclerosis. We have randomized controlled trials. They started with Sativex. The Sativex is 1-to-1 CBD THC, and they were produced also for GW Pharma. They did randomized controlled trials, and the evidence tells us that medical cannabis, precisely ratios 1-to-1 CBD THC, are good for treating these patients in the cases of the patient having spasticity. And also they show that the patient improved the quality of life. This is a very important too. So we have randomized placebo-controlled trials with multiple sclerosis. Another pathology that we have also good evidence is with chronic pain. We will divide. Chronic pain is a very big word that they can relate to so many things, but I will give just like a very quick review. In this part, I will divide chronic pain like oncologic pain, like for the patients who have cancer, and non-oncologic pain for the patients that have different type of chronic pain, like fibromyalgia, rheumatoid arthritis, and the different types of pathologies that produce the chronic pain on patients. So we have a very good amount of systematic reviews and randomized controlled trials showing that medical cannabis is helping patients with chronic pain. And the latest thing and the most important thing that is actually that Canadian Pain Association even removed medical cannabis. It was like a fourth line agent. Now they move it to third line agent. Well, this was a long time ago, like 4 years ago. So we see the pain associations giving a space for medical cannabis. And also we know that there is a opioid crisis in different countries, specifically in the United States. We see the mortality for opioids overdose. So in this part, it's very important the role of cannabinoids, because we see that medical cannabis is a good substitute or is good as an add-on therapy in patients that are taking opioids. So when you start to treat a patient that is on high doses of opioids, you can start reducing the doses of opioids. There is like a protocol for doing this. It's a specific protocol for this, and you start reducing the amount of opioids and you start including into the therapeutic program cannabinoids. And there is very good studies showing how almost 50 or 60% of the patients that are using opioids, when they start using cannabinoids, they improve much and they get better, and they even are able to reduce the opioid use, which is huge because we know opioids, besides the opioids overdose, there is something really bad. Opioids have other side effects like depression, constipation. So when you have a patient with terminal cancer and it was in a lot of pain that it has to use opioids, when you give these patients medical cannabis added to the opioid treatment, you see how the quality of life of these patients improve. And this is something that is so beautiful about medical cannabis, that every time you add on the therapy with cannabinoids, you improve the quality of life of patients. And the other pathology or the other treatment that it has good scientific evidence behind is for the nausea and vomiting induced by chemotherapy. We have good randomized clinical trials showing that the use of cannabinoids in these patients is really good. And these studies show that the use of cannabinoids plus another anti-emetic treatments has very good results. So in these groups of pathologies that I mentioned is that we have the highest scientific evidence, as I mentioned, randomized controlled trials. We have other levels of evidence that I'm not going to go into that. And there is a lot of interesting research going on. But regarding to the gold standard scientific evidence, are those group of pathologies, the ones that we have more scientific evidence around.
Yeah, that's brilliant. And thank you for that summary. That's quite good to put it into those buckets. And without needing to go into every single other condition, which one that you haven't mentioned is looking the most promising in terms of reaching that gold standard?
Well, I see a lot of studies right now in looking into anxiety, which is, and now for this pandemic, we have been seeing, and personally, I see in my clinical practice, a lot of patients with anxiety. So CBD plays a very, very important role. And I've been seeing a good amount of research. So I hope that very soon we will have systematic reviews and RCTs done in the proper way. And neurological pathologies. We've been seeing some interesting studies in Alzheimer's and Parkinson, but we still need more research in order to achieve those randomized controlled trials and the high quality evidence. But I think medical cannabis is very promising for these pathologies.
Absolutely. And I mean, the final one that you mentioned, I don't really know anyone that hasn't got some kind of anxiety issue. So I think that would be very welcome in today's world. That's been brilliant and really comprehensive. Well, one of the areas that I find personally very kind of interesting, and I wonder what your view on this is, how important is the format and the delivery of the medicine? Obviously, cannabis flower is what most average people would assume cannabis is all about, but obviously there's oils and tinctures and extracts that you can make from the flower. How do you see that kind of part of the puzzle?
This is a very important piece of the puzzle because as I see in my clinical practice and of course in the theory and the practice, delivery methods are a challenge right now. We know we have the oral presentation like capsules, we have tinctures, oils, sprays, sublingual, we have suppositories, we have patches, we have the inhaled flower. But regarding to the inhaled presentation, we know it has a shorter duration of the effect. And when you're treating patients with chronic conditions, you need to have like a steady seric levels. So in blood, the patient will have a constant amount of cannabinoids. So will achieve the control of the symptoms. So that's why the oral or sublingual presentations are so important in the control of the patients, because we have the inhaled presentations that are good for flare-ups when the patient has pain or when you need to have a very fast response. But for long-term, oral presentations are more important. And the challenge I see in here is that some delivery methods, usually when the patient ingests capsules, there is a lot of factors that are playing a role into the absorption and into the effect of that medication. So many times the absorption of oral presentations will be 15 to 20% is very minimum. So I am very happy to see, and I just read this week some research that they're doing about using microencapsulation for the short-term oral bioavailability of the cannabidiol. And I've been seeing nano emulsification and other delivery methods that will improve the absorption and bioavailability, because sometimes you have to give high doses of the treatment to the patients, because you know that the absorption is not as good. But if we manage to have all these novel delivery methods, that it will improve the absorption and bioavailability, we can even reduce the dosing on the patients. And I think long term, this will revert in the patient having to take less volume of medication. So this is something that is very exciting for me to see new research coming regarding to this, because this has been a big challenge in the clinical practice, because sometimes the absorption is different and is different from patient to patient according if the patient ate some before. You always give recommendations, but yes, delivery is something really important.
Yeah.
Delivery methods.
Yeah, I mean, I'm lucky I get to speak to quite a lot of companies that are developing IP and technology in this space, and it's fascinating to see how everyone's approaching it, and it's a big challenge to try and solve. So hopefully we'll make some progression in that area soon. It's been great, Sandra, and as we sort of come to the end, I wonder, this is quite a big and open question, but what are some of the real difficulties in establishing evidence for something as complex as cannabis, or in general plant medicine, being kind of having multiple active compounds?
Yes, actually, that is the biggest challenge right now, because most of the RCTs, randomized placebo-controlled trials, are done isolates or with, as I said, Sativex, that is CBD, THC. It's hard. We have some evidence and good evidence with whole plant, but it's very complicated to produce the quality of evidence that all scientists want regarding to medical cannabis, knowing that the plant has more than 400 compounds. So it is challenging, but I think also, besides RCTs that I consider they are very important, we cannot dismiss the real world evidence. In our clinics, we are focusing a lot on that, because through the real world evidence, you can even see and prove that a treatment is working in certain capacities. And that will lead you to create randomized controlled trials. But I think the real world evidence is a good starting point for all these pathologies that we have this challenge in producing the RCTs. So that is a challenge, and that is why it's hard to have more research. But always when people tell me, or the people with the skepticism saying there's not enough evidence, I present all these randomized clinical trials that I just mentioned regarding to these pathologies that we have very good evidence. But we actually cannot dismiss the real world evidence. I am very excited to see how in many countries they are developing different type of RCTs. And for me, it's very important also that last year, the UN rescheduled medical cannabis, because even that we're still in a category that is not like the best, I think that a lot of governments will take that statement of the UN by the recommendation of the WHO that medical cannabis has potential therapeutic applications, and they are relaxing a little bit, not enough, not as much as we want, but they are relaxing a little bit the policies for research, because before we were totally locked. Nobody wanted to invest in this since it's still in that category. So I think there is a lot of challenges regarding to research, but I see, and I will finish with this quote. 2 years ago, I was invited to Harvard Medical School, where a very interesting team is doing research and nanotechnology and delivery methods, targeting with micro drones technology, pancreatic cancer. This is in preclinical, in animal models. So it gives me hope to see how scientists all over the world are focusing on this, because there is a lot of potential that we can unleash when we do proper research.
Yeah, it's very exciting and very futuristic in a way, isn't it? A bit. Yeah, really good that you brought up the real world evidence aspect of it. And I think I saw a statement from the FDA a few months ago saying that they would be also taking into account real world evidence, which is, a good sign that kind of major institutions are open to this. But that would be a whole new topic that we could have a whole separate show on. So that feels like a good reason to have you back on the show at some point. Thank you, Sandra.
Thank you so much, Anush, for the invitation. I really think you're doing something very important, because education is the key for being able to destigmatize the use of medical cannabis. And through programs like your program that provides reliable education and reliable information, is that we will use the medical cannabis in the different communities.
Absolutely. And thank you for saying that. And likewise, you're doing a fantastic job in educating doctors and the world on medical cannabis too. So I very much appreciate your efforts, and thank you for joining me today.
Thank you so much.
Cheers.